very much for joining us and throughout the pandemic for joining us and making time for us.
My pleasure.
Now, I think lawmakers, maybe even academics, are trying to sort through this from coast to coast, maybe even worldwide. But what should and can double vaccinated plus 2 weeks, what should they be allowed to do and what can they be allowed to do? Have we figured this out yet?
Oh, that's such a loaded question. Here's why it's a loaded question. Vaccination is fantastic. It's not perfect. Everyone understands this now, I think. We do have some cases of breakthrough infections. And the breakthrough infections happen when the disease is highly prevalent. So while it's percolating around us, vaccination alone is no guarantee either of lack of infection or lack of transmission. However, most experts agree that 2 fully immunized people, meaning 2 people with 2 doses and 2 weeks later, can probably be together indoors without a mask. So they're probably okay. The problem is when vaccinated people are around unvaccinated people. What do you do then? Or when you've got people with 1 dose, what do you do then? That's largely an unknown scenario, but to the extent that we know anything, it's going to be complicated by what's happening in the community. That's a long-winded answer, but there it is.
Yeah, kind of long-winded. So we are in that situation, a lot of us. I feel like I want the neon sign above my head saying, yes, I am officially fully vaxxed. I've had my 2 weeks. My parents are both fully vaxxed. They've also had their 2 weeks. So we're at that point, and they're older. So driving in the car, do we need to be wearing our masks all the time? It's these simple interactions, and I think people are just like, throw me a bone, Raywat.
Yeah, I mean, my personal opinion and what I tell my family to do is if you've been fully vaxxed, you can be in the car together without a mask on, absolutely. But beyond that, it's difficult to give advice. So what do you do around the unvaccinated people? Like children. Children are a tough one.
Kids. Yeah,
exactly.
Absolutely.
Right. So that's why we got to be careful what we say until the numbers come down. This is not interminable. It's just for, a few weeks until the numbers come down. I'm fond of saying there are 3 kinds of indicators we should watch. There's the vaccination numbers, which are the population statistics. There's the epidemiological numbers, which are the extent and trend of the disease, especially locally. And there's the health system's capacity numbers. That's, how much space there is in the hospital. So if there's leeway in the hospital, you're probably fine to do more things just in case you get sick, taking up a hospital bed by somebody else. A lot of moving parts here, which is why this is best advice given at the local level, because granularity is important and the situation is different everywhere across the country.
Well, let's talk about that Delta Plus variant and give us a world perspective here. Where is it in the country? Where is it in North America and then worldwide?
Well, Delta Plus is most commonly in India. I'm not entirely sure where it is outside that, except it has been identified in the UK. It's Delta we care most about. So what do we know about it? It's more contagious, probably. It might even be more deadly. So it is worrying. As we all knew, there would be more problematic variants arising as time goes on, especially in the high transmission areas like India, right? So this is not surprising. And as far as I know, it does seem to work. Our vaccines still work against it, which is the good news.
So this doesn't lead us to that 4th wave that you've been talking about, or does it?
Well, if a 4th wave happens, it'll be because of Delta and or Delta Plus. Now, is Delta Plus in Canada? I think there are a couple of cases that are known. There's some cases in the US that are known, India, Japan, some parts of Europe. Delta is bad enough. So if we control for Delta, we control for Delta Plus, in my opinion. So let's focus on Delta for the moment. It's the things we do to control that will work against Delta Plus, as far as I know.
I think the only Delta Plus people want is like rewards points for flying on Delta. So the only way we can get through this is by ramping up those vaccinations. And as we know, we've had a bit of a dip in the supply of Pfizer. I'm assuming that that's a Canada thing, not a Manitoba thing. Do you expect that Moderna will get that approval in a timely fashion from Health Canada? They've had the ask in for over 2 weeks.
Yeah, I think we'll get it sometime in the fall. Now, I can't predict how decisions are made and what timeline decisions will be made in, But I think the data, at the very least, will be ready for us by late summer, early fall. And so there should be everything on the table needed to make a decision. I fully expect the Moderna vaccine to be cleared for young people, and I expect the under 12s to be okay sometime later in this year as well. That's important. We don't reach herd immunity unless we vaccinate children, unfortunately. I wish I didn't have to say that, because a lot of parents don't want to vaccinate their kids, and the only real compulsion for child vaccination is to contribute towards herd immunity. But that's what it's going to take.
So I think that some people are hoping that Moderna decision will come a little faster than this fall, given the data that's out there. But in the meantime, what should parents do? And I've heard anecdotally of people saying, listen, I want to ask my hairdresser, she's fully vaxxed, before she cuts my kid's hair. Is that how some parents will be looking at this before, exposing their child to someone, making sure that the person they're dealing with has vaccinations?
Yeah, and that's a wise way of doing it. It's also a way to incentivize adults getting vaccinated. Kids can't get vaccinated. Adults can. Those who can get vaccinated should get vaccinated. So anytime we can unroll incentives for that, the better. If an incentive is, hey, you get access to this kind of work and to my child to do other kinds of services, then that's great. It's also a wise thing to do. I noted earlier that vaccination is not perfect, but it does substantially diminish the probability of infection and transmission. So you're much safer around a doubly vaccinated person than someone who's not. And to the extent that we have outbreaks happening, like in Ontario right now, there's a big outbreak in Waterloo, almost all the cases are amongst the unvaccinated. Right? So that's where this disease is happening. That means your children. So the way we protect our children is to build a wall around them of vaccinated people who cannot introduce infection into their little bodies.
Raywat, we always appreciate the time. Thanks so very much for joining us this Thursday afternoon.
Thank you.
Raywat Deonandan from the University of Ottawa.